Today, I'm going to walk you through 3 simple ways to make your to-do list shorter, less overwhelming, and more manageable. That sounds good to you? Let's jump right in. If you work in public health and feel constantly overwhelmed by your to-do list, you are not alone. Most women in public health are carrying workloads that are not designed for one person. They're actually designed for 3, and it's exhausting. I'm Marissa McCool, the public health burnout coach, here to help you reduce your stress and reclaim your life. I worked in public health for over a decade, and I know firsthand what it's like to be juggling shifting priorities, unrealistic expectations, overwhelming workloads. In 2017, I hit burnout, and learning how to manage my workload differently changed everything. Now I coach other women in public health on how to eliminate their burnout, set boundaries, and create work-life balance in a way that allows them to continue to make an impact in their career in public health. In this video, I'll be teaching you 3 simple strategies you can start using today to make your workload feel more doable, even if your boss or job or projects don't change. So here's your first tip. I want you to cut your weekly to-do list in half. I know, this seems drastic, doesn't it? Your brain might be freaking out right now as I share that. That's okay. That's how I felt when I first heard this tip too. But one of the biggest reasons women in public health feel overwhelmed is because we start the week with a list that is simply not humanly possible to get done. It is said that humans overestimate what we can get done in a day and underestimate what we can get done in a year. We might list 20 to 30 things to get done in a work week when really we only have space to get 10 things done. So here's what I want you to do instead. I want you to write out your full list of to-dos for the whole week, then cut it in half. Doesn't mean you're lazy. It doesn't mean you're incapable. It means you're being realistic about your capacity. It means letting go of the false fantasy that you can get all those 20 to 30 things done in a week. That's not realistic. When many of my clients do this, they immediately feel calmer because they know their list is something they can accomplish. When your list feels doable, you actually get more done. You're more motivated to get things done. You're more excited. You feel so much more accomplished by the end of the week because you got it done, rather than feeling disappointed that you didn't get it all done. So I want you to ask yourself, what are the 10 things this week that truly matter? Here's tip number 2. Pick 3 priorities for the day. This is where things really shift. So each morning, pick the top 3 priorities to do that day. Not 10, not 7, just 3. Why 3? I know that seems small. I teach my clients the most effective organizational and calendaring system in the world. It truly transforms their experience. They can leave work early, they get their to-do list done, they get to their workouts, they take their lunch. And so through what I've taught, I know that 3 priorities for the day is the sweet spot because we're factoring in the meetings we have, being interrupted, the unexpected needs, our basic needs like going to the bathroom and drinking water. We can reasonably get 3 priorities done in a workday. This sets you up for success. And listen, if you happen to get 4 done instead of 3, great, we can celebrate that. But it's so much better than setting ourselves up to try to do 6 and only getting 3 done and feeling disappointed and discouraged and a lack of motivation. Here's why this works so well. Humans are more motivated by positive reinforcement. So when we set ourselves up for success by aiming for 3 things to get done and we get those 3 things done, we are more motivated. We have that natural motivation and excitement to get work done tomorrow. Versus if we aim for 6 and we only get 3 done, then we feel shame, we feel guilt, we feel discouraged. And that's like dragging a weight with us into the next day of work. Here's tip number 3. I want you to break your tasks into chunks. You might have heard this advice before, but public health work especially can be complex. We're writing reports, supervising staff, preparing for site visits, managing grants, whatever it is you might be doing. All these tasks can feel very overwhelming. The solution is to break every task down into tiny, doable steps. Small enough so your brain says, oh, I can totally do that. So I want to give you an example from my time in public health. I was the assistant director of a HRSA-funded grant center, and our renewal was coming up. Now, on my to-do list, originally I had start renewal, start grant renewal. Every time my brain looked at that, I felt so overwhelmed. It was way too vague. When something is vague, our brain shuts down. It creates overwhelm. So breaking that task down into tiny doable steps made it seem more manageable. For me in this example, the first step was renewing the NOFO, the Notice of Funding Opportunity, but I broke it down even further. Read and highlight the key sections in the NOFO. So on my to-do list, on my calendar, when I saw that task, it felt doable, it felt manageable because I had clear direction. Okay, I can do that. I can read this and I can highlight the sections. The next thing I broke down was review the prior grant application. I even got more specific. Review the prior grant application and highlight what parts of the grant we can revise, we can reutilize. So then when I saw that on my to-do list, it felt so doable. Okay, I can totally do that. And guess what? It reduces my workload. Now for me, when I break down the tasks like this, I actually schedule it out on my calendar. That's part of the calendaring system I teach my clients. I find it to be really effective to put those tasks in the calendar. Then suddenly a giant task or project becomes small steps that you can tackle even on the busiest days. This not only reduces your overwhelm, but it increases your momentum. So let's recap what we learned in this video. The 3 ways to stop feeling overwhelmed by your to-do list. First, cut your weekly to-do list in half. Second, pick 3 priorities for each day. And third, break big tasks or projects into small, doable actions. These are simple, but they're powerful, especially for working in public health, where our workload is heavy and there are always challenges and there's not enough staff and not enough time. So if you're a woman working in public health and you want more tools and tips and strategies to feel in control of your time, to have more time for your life, reduce your stress, make sure you hit subscribe, new videos coming out every week. And comment below. Let me know which of these tips are you going to try this week. I'd love to hear from you. Talk to you next time. Bye, everyone.